Hello, good morning everyone. I am Dr. Nisha Batnagar, Senior IVF Specialist from AVEYA Fertility and IVF Center. Today we are going to talk about a very important topic, that's IUI. IUI or intrauterine insemination. So today we will talk about what is IUI, for who it is needed, what is the preparation needed for IUI, what is the success rate, and many things related to it. So what is IUI? IUI or intrauterine insemination is a procedure where washed and prepared sperm sample is injected directly into the uterus. This means that the healthy sperms are available near to the egg once the ovulation happens, and that is the aim, to keep the healthy sperm available near the egg during ovulation. Who needs IUI? There are few patients who are not able to have intercourse at the given time for some reason, number one. Number two, maybe the husband is outside, traveling or something. There is a male factor, mild male factor. The count and motility is little bit on the lesser side. And the most important thing, it's a first line treatment for unexplained infertility. When we know everything is good, the patient is having ovulation, egg is rupturing, tubes are open, semen parameters are good, but still they are not getting pregnant. So the first line treatment is IUI or intrauterine insemination. So how do we prepare for IUI? There are few tests needed for IUI. We basically, for the husband or the male partner, we do the viral markers HIV, HBsAg, VDRL and anti-HCV. We also check the diabetic status and the thyroid levels of the husband. Then we do a basic semen analysis and see the count and motility. In the female, the tubes should be open. So tube testing is an prerequisite for doing a IUI. Number two, she should be ovulating. She should be having regular cycle. And number three, there is all the hormone values and everything is normal. Usually if a patient is married for less than 1 year and they are anxious for pregnancy and we don't want them to recommend for IVF, IUI is the first line treatment. After doing all these investigations, how do we do the procedure? So the patient visits us on the second day of the period. We do a baseline scan. We check the status of the ovaries. We usually give them some sort of ovulation induction. That means that the aim is to form either 1 or 2 follicles, so that they are putting so much of efforts, coming to the center, getting the scans done. So if we have 1 or 2 follicles, the chances or success of IUI is little bit on the higher side. So on the second day we scan the patient, the female, and we give them some sort of medication for ovulation induction. Usually it is either clomiphene citrate or letrozole, depending upon the case. This medication is usually for 5 days, and then a scan is repeated, ultrasound is repeated. On the ultrasound we see the growth of the follicle, and if needed, another medication which is called gonadotropin, it is added. These gonadotropins can be added from the second day of the cycle also. The aim, again I told you, is either to have 1 or 2 good follicles. So serial ultrasound monitoring is done, and once we have good follicle of about 20 millimeter size, a final injection is given which is called trigger. The purpose of this trigger is to have the rupture, induce the rupturing of the follicle, so that ovulation happens at the given time. Once the ovulation happens, the IUI can be performed. Usually the IUI is single IUI. That means after giving the trigger, 36 hours later we do the IUI. However, in some cases people prefer to do double IUI also. That means 1 IUI is done prior to rupture of the follicle and 1 IUI is done after documenting the rupture of the follicle. Here I would like to tell you that the sperm sample stays in the uterus alive. The semen stays in the sperm stays in the uterus alive for a period of 24 hours. So if we are putting the semen sample just around the rupture and we are doing a double IUI, it is believed that it may increase the chances of success. But in literature, there is no difference in the success rate of single or a double IUI. Your doctor may recommend you depending upon your condition and the rupture of the follicle. The procedure is very simple. In fact, IUI is the first line treatment because the procedure is very simple. It is non-invasive. The patient doesn't need to be admitted or given any kind of anesthesia. The husband comes in the morning to give the sample. We prepare the sample. It takes around 45 minutes to 1 hour to prepare the sample. This is usually happening 1 hour prior to the time of IUI. For example, if you have taken the trigger injection at 10 p.m. and your IUI is scheduled 10 p.m. on 2nd of September, your IUI would be scheduled on 4th of September at 10 a.m. So the husband comes and gives the sample at 9 a.m. We prepare the sample and we do the procedure IUI. So this is the general normal anatomical picture of a female genital organs. This is the vagina, this is the uterus, these are the tubes, and this is the ovary. The ovulation happens from the ovary. The tube picks the egg, brings it inside the tube and the middle part. Normally the husband puts the sperm here. In IUI, a washed and prepared sample is injected inside the uterus here, okay, so that the egg is easily available, the sperm is easily available near the good egg. So during the procedure of IUI, we put a small cannula which is like a thread, very simple thin cannula from the vagina into the uterus, and we deposit the semen here inside the uterus. So now we'll talk about the success rate of IUI. So success rate depends upon the selection of the case. What I mean by that? So let me give you an example. If a female is 38-39 years of age, is having low ovarian reserve and is married for long with a normal semen parameter and open tubes, the chances of IUI working here would be less. Why? Because here we might be suspecting the egg quality might be the reason. So for IUI to be successful, usually it works very well for younger age group where unexplained infertility of less than 1.5 year duration, the male factor is mild, it's not severe, and there might be suspected cervical factor. However, again, the reason of failure is the egg quality might be the reason, the embryo quality might be the reason. We don't know about how the embryo is when we put the egg and sperm together. The tubes may be patent, but they may not be functional. There might be some paratubal adhesions, there might be some flimsy adhesions, or the cilia might be damaged, or there might be implantation failure. For these cases to be successful, if 1 or 2 cycles of IUI don't work, I recommend to move on to IVF. So the number of IUIs should be around 3. You should not attempt for more than 3 cycles of IUI. If it is not working in 3 cycles with good stimulation, good ovulation, mild male factor, you should move on to IVF. Nowadays, we are seeing another indication for IUI, which is severe vaginismus because of the age factor, or because of those so many stress factor or something. There are females and there are couple who are not able to have normal intercourse. So in severe vaginismus, or for patients who are husband is traveling outside, the IUI can be done easily with a good success rate. I would tell you about a case of mine where the patient was around 28 years of age. She was having regular ovulation. They were married for 3 years. There was no male factor. It was good semen analysis and the tubes were open. The patient were having regular intercourse, but they were not able to get pregnant. We simply did a cervical swab culture and we found that the patient had some sort of cervical infection. The cervix, the mucus of the cervix was very thick. So what we did was we induced ovulation. We gave her some sort of estrogen to form a good lining, and at the time we gave her 2 follicles were there. We gave her Clomid only, and supported with little bit of gonadotropin, she formed 2 beautiful follicles We ruptured, we gave her trigger, and 36 hours later we did a single IUI and the patient was pregnant after 15 days. If you have any questions or you want to know more about IUI or whether it is for you or not, please feel free to contact us at the given numbers below. Thank you so much. Bye for now.